Okay. Welcome to the YouTube channel of Novacrest Hospital, formerly known as Peak Specialist Hospital and Diagnostic Center. Novacrest Hospital is a mental health facility here in Abuja, Federal Capital Territory of Nigeria. It has been in existence for about 12 years. Here at Novacrest, we pride ourselves with excellent mental health care management. Our care is usually tailored towards the individual needs of our clients, and our team of professionals are dedicated and responsive to these needs of our clients. My name is Dr. Waneka Edet, and I'm one of the medical doctors practicing here at Novacrest Hospital. And with me is a consultant neuropsychiatrist, Dr. Uchendu UI. You're welcome, sir.
It's a pleasure.
Sir, please, our viewers would like to know more about you.
Well, my name is Dr. Uchendu UI, consultant neuropsychiatrist and executive director of Center of Information and Prevention of Mental Disorders, SIGMED.
Thank you, sir. Sir, how long have you been in the field of mental health, please?
Yeah, in the field of mental health, I think I've been in this field for about 21 years. Started my medical career in 1996 with Gwagwalada Specialist Hospital, now known as University of Abuja Teaching Hospital. I worked there as a medical officer for 6 years. And then I got into mental field in 2002 with the Federal Neuropsychiatric Hospital, Uselu, Benin City. By 2009, I got my fellowship with National Postgraduate Medical College of Nigeria, and then the same year was appointed as a consultant and a pioneer head of Department of Mental Health by University of Abuja Teaching Hospital, where I worked as the head of department till 2018, and then retired from the service of the hospital in 2022. Currently, as a consultant with Novacrest Hospital, Abuja.
Thank you, sir. Sir, talking about mental health, please, can you give us a background on the concept of mental health?
Yeah, well, when we want to talk about the concept of mental health, we have to look at it in this way, that mental health is an aspect of health, looking at health generally. And just to remind us what I know some of our viewers must have heard or known, when WHO, that is World Health Organization, in their definition of health, they say it's a state of well-being, physically, mentally, and socially, not merely absence of disease or infirmities. In that, mental health is the second component when you want to look at health holistically. And then WHO also were able to give us a definition of what mental health is all about, which they stated as also a state of mental well-being in which an individual is able to realize his or her ability, also has the ability to be able to cope with normal stress of life, be able to contribute meaningfully to the society in which that person belongs. And the fourth one, that is also being able to be productive and fruitful. When someone is able to accomplish 4 of these components, you will be able to say that yes, this person is actually having a very good mental health. And that also indicates that absence of any of this could indicate there's a problem with mental health of such an individual. Going forward, mental health, when there is a challenge, could lead to a disorder. And that is probably what we might need to look at when we start talking about mental health disorders.
Okay. So now that you've mentioned these mental health disorders, I'm sure a lot of our viewers have heard about mental health and they know that definitely there will be mental health disorders. So can you also expatiate on the mental health disorders you just mentioned?
Yeah, well, when we want to talk about mental health disorders, usually I tell people that the most important thing is knowing what is normal, and immediately there's an abnormality, then you can start thinking about a disorder. Looking at mental health disorders is almost the same way probably you talk about physical disorders. The normal is known, immediately there is a deviation from the normal, disorders is said to have occurred. A definition of a mental health disorder, which is one of the definitions I like quoting, which talks about is a disorder in which there is a psychological disorder or behavioral disorder in which one, there is abnormality in emotion, perception, affect or mood. You talk about thoughts, and then the fifth one is the emotion, thoughts, affect or mood, perception, and then behavior. When there are deviation from the normality in any of these, you could say yes, this person is actually exhibiting one or the other aspects of any type of mental disorder.
Okay, so you mentioned 5 things: emotion, thoughts, perception, behavior, and affect. Can you expatiate a little bit on those?
Yeah, well, like I said before, normality is the key word. When there is abnormality, deviation could be to the right or to the left from the normal in any of these. Let me give example of behavior. Somebody could be too quiet, isolated, is deviating from the normal function or normal behavior. You could say that yes, that's a problem. Somebody could be too excited, too hyperactive physically. You can look at it that this is actually a deviation from the normal, and that could be termed that there's a problem with the mental health. The same thing could go to affects or the mood. Mood could be so high, mood could be so low. In the same way, thought processes could be so much distorted. The same way we can think about perception. And when we talk about perceptions, we are talking about the normal five senses: sense of sight, sense of hearing, sense of smell, sense of taste, and sense of feeling. Immediately there is a deviation from the normal to any extremes of these, whatever, you can now say yes, there is a challenge with the mental health of such an individual. Also emotion. So when we start discussing probably the causes of mental illnesses or disorders, or we start talking about different types of disorders, how it affects our normal functions, we'll be able to expatiate on this. But one thing I want our viewers or our listeners to take home with today is to understand that immediately, for any reason, there is a deviation from the normal, depending on the person's age, depending on the person's gender, depending on the society in which that person grew up. Maybe there is obvious gross deviation from the normal. We should start thinking about the mental health of such an individual. Thank you.
Thank you very much, sir. So thank you, viewers, for tuning in to watch us today on our channel. We hope when next we're going to have a viewing that you all will be present and you'll be able to gain from whatever we'll discuss next. Thank you.